Anytime I say I've had a stroke, everybody looks at me like, you had a stroke. You're so young. And I say, well, anybody can have a stroke. I was at the store and I started having some numbness in my right foot, but it just kind of went away really rapidly, so I didn't really think anything of it. I woke up in the morning and my entire right side was numb. And that was the first time I thought I might be having a stroke. I went into the emergency room, and it was after that I started losing my ability for speech, and the numbness really kicked in.
So take a look at my nose right here.
That was when I met Dr. Lowenkopf. He came in and sat with me and said, "You've had a stroke."
Kim came into the hospital with stroke symptoms, suggesting that she wasn't getting enough blood to the left side of her brain. Look at my finger here. When I examined her initially, she had minimal symptoms, just a little bit of numbness. She had a CT angiogram where some dye is injected in a vein in the arm, and we can take a picture of the blood vessels as they go up to the brain. And what it showed was that she had torn the artery in the left side of her neck.
I went home with the orders that I needed to come back in and have a blood test the next day to make sure that the medication was still the right dose and was working correctly. And on my way back in, I had another stroke and went back into the emergency room.
The tearing had had extended, and she was not getting adequate blood supply to the left side of her brain.
They did some other tests for me, and then Dr. Lowenkopf and Dr. Thiesing came in and said, well, we need to do surgery and put some stents in there to open up that artery and get everything working correctly. 1, 2, 3. I have a daycare, and so I care for children, and I'm a single mom. And of course my kids were just, it was quite an experience for them because it was very frightening. What are more sporty, skateboards or water guns? They're just so thankful, and they love Dr. Lowenkopf as well. He really is a great guy, and was really good with them and my family.
Kim is very lucky, and she's in a minority of stroke patients. Our biggest challenge is getting people to recognize the warning signs and to call 911, where her symptoms were relatively mild. We found a treatment to prevent recurrence, and she's been able to resume her normal life. If we can treat someone who's having a stroke within the first few hours, we can often prevent the disability that's associated with stroke.
The fact that I didn't know still strikes me, is very scary, and I just feel so fortunate that I got here in time to make sure that there wasn't any permanent damage done. It says, thank you, Dr. Lowenkopf and St. V's for helping Kim. Try not to take as many things for granted, and you realize that every day is important, and cherish it.
Providence Stroke Center cares for more stroke patients than any other provider in Oregon and is a national leader in stroke research. A multidisciplinary team guides each patient's care, both at the hospital and after the patient returns home.